After stem cell therapy, after laser treatments, after all kinds of medical aesthetic procedures, our patients ask us, what should I use at home? They say things like, I have dark circles under my eyes, my face isn't moisturized, or my skin is irritated. They ask what they should use for these issues. So let me give you some information on that. I especially recommend using creams with hyaluronic acid during the day. When you apply this as a thin barrier to your face during the day and then apply a sunscreen on top, specifically an SPF 50 sunscreen, that's sufficient. This not only increases the skin's moisture level, but also provides a bright, beautiful appearance. It also helps get rid of your fine lines. In addition, there are vitamin C creams, retinol creams, niacinamide creams, and many other kinds of creams. But for daytime use, I specifically recommend hyaluronic acid creams. If you have dark circles under your eyes, I advise using caffeinated creams. Caffeinated creams are incredibly effective at reducing under eye circles. It's very beneficial to use them twice a day or at night before bed. My patients ask a lot about retinol creams, but I strongly advise against using them after SVF or especially after laser treatments. This is because retinol is an irritating cream. If your skin is already irritated from laser treatments, we do not recommend using retinol afterward. After about 4 to 6 weeks, once your skin has renewed, retinol creams can be very beneficial, but I recommend using them at night. The way to use it is this. First, apply a hyaluronic acid to create a gentle barrier on the skin. Then apply the retinol on top of that. Afterwards, apply another layer of hyaluronic acid to create a barrier over the retinol. In other words, you sandwich it in between. Use retinol creams this way, but don't use too much. An amount about half the size of a chickpea is enough for both sides. Some of these you can use under a doctor's supervision, while others you can buy online and use yourself. And I especially recommend that after your 40s and 50s, you make a point of continuing to use these types of creams